The study highlights that illicit alcohol now accounts for 18% of the total alcohol volume consumed in South Africa. This translates to roughly 1 in every 5 alcoholic beverages consumed being illicit. Illicit alcohol refers to any alcohol not compliant with the laws of South Africa, including counterfeit products, stock that evades duties, or that enters the market illegally. It also includes potentially dangerous products that may be homemade or industrially produced concoctions. Researcher at EuroMonitor, Benjamin Rideout, says the problem extends beyond just financial loss, but directly impacts public safety and consumer confidence.
Volume terms now, the main driver is counterfeit and illicit brands, so fakes and copycat brands. Next is the value sales, so illicit traders in alcohol are making 25 billion rand annually for last year, which again is driven mostly by smuggled and contraband products, but also your counterfeit products as well. And finally is the tax loss. Tax loss for last year stood at 16.5 billion rand, which has increased significantly from, I think, 10 billion or so the previous time. In terms of the drivers, what's driving this, it's really just most South Africans are struggling at the moment. So firstly, it's affordability, because people are, as I said, they're looking for something cheaper, which introduces the aspect of danger and the risk to the consumer.
Ingredients that can have serious health implications were found in samples of illicit alcohol that were tested. Dr. Shamal Ramesar of the Drinks Federation of South Africa says chemicals found in tested samples can lead to death.
Some of these counterfeit samples and subjected it to chemical analysis in some of our laboratories in the University of KwaZulu-Natal. And some of the chemicals that we're finding are extremely horrific. So the number one chemical is methanol. And methanol, as you know, is associated with irreversible blindness, various different metabolic disorders such as respiratory failure, cardiac failure, and in worst case scenarios, these are going to cause death. We've already heard of the artists last year in Vietnam that consumed alcohol laced with methanol that demised. There were students in Laos that also consumed alcohol laced with methanol and demised. Beside methanol, we're also starting to see now industrial grade ethanol, which can cause blood disorders. It can cause respiratory failures as well. We're also finding traces of substances like acetone.
The illicit trade creates an unfair playing field for legitimate businesses. SABC CEO Richard Rivet-Kanak says there's a price difference of over 30% between legal and illicit alcohol on average. He says this price disparity, coupled with consumers facing financial pressures, makes illicit alcohol an attractive option. Unlike legitimate businesses, illicit operators do not pay taxes and do not comply with regulations.
Times people are looking for a drink. They're not choosing the formal market, they're choosing the informal market, which obviously has an impact on SAB, on all of the formal retailers and manufacturers in South Africa who are paying their taxes, employing people. Their businesses get hurt.
Isusu of the National Consumer Commission has urged consumers to report suspicious products and encouraged retailers to empower themselves with knowledge to avoid inadvertently dealing in illicit goods.
Just about trade. It's about protecting consumers from unsafe and fake products in the markets. So consumers have a right to know what is it that they are buying. So what's important for us from the National Consumer Commission is to ensure that our consumers are empowered and are aware that if they come across unsafe products, where do they report? They have to report those to us so that we can investigate, because it's very important that we ensure that our consumers in the countries are safe, because if they consume these illicit products, the health consequences are dire.
The study shows a staggering 83% of consumers are unaware that purchasing counterfeit alcohol could lead to health concerns. About 49% of respondents knew someone who had experienced serious health effects from illicit alcohol, and 29% of them knew someone who had died from it. Gloria Sefakomusi, SABC News, Johannesburg.